So again, thank you for joining us for our monthly community of practice. We are recording, and this session will be added to our PFCC Partners YouTube channel. There will also be a live transcript. If you have not already joined or subscribed to our YouTube channel, I highly recommend that you do so. So if you're not familiar with PFCC Partners, this is who we are and this is what we're all about. We want to see a health system transformed into one that works with people and through communities as a partner in their well-being. We catalyze system improvements by engaging the human experience of health to improve health outcomes for all. These have been our values since we opened in 2010 and still guide our interactions and partnerships today. So we all know that healthcare is complex, it's difficult to navigate, and even more difficult to change. We recognize that the complexity is layered into the multiple systems of the healthcare system and environment. That's what makes it so hard to change. Uh-oh, excuse me. Pressing too many things at once. PFCC Partners recognizes the need to open space for patients, family caregivers, and community voices to drive these improvements in the complex system. We know these voices are a huge catalyst for improvement and system change. Our team has decades of passionate experience partnering with healthcare systems and leaders, engaging those with lived experience in those efforts to improve the change. PFCC Partners works to open spaces, creating partnerships that allow for improvement. The way that we do this is through the PFA network. Once PFCC Partners opens that door for impactful partnership, the PFA network, is available to fill it. With more than 1,100 diverse patient family partners ready, willing, and able to collaborate, our health system partners have ready access to community representing diverse needs and experiences within the health systems. So with that, I am so excited to share today that we have one of our partners that is presenting today. Our topic is the Community Engagement Roadmap, Reshaping Care Through Authentic Partnerships with People with Lived Experience. Have the privilege of introducing Mark Humawicki, who will be joining us a little bit into the presentation. And starting us off will be Victor Murray with the Camden Coalition. Victor?
Great. Thank you, Naomi. Just really excited to have this session and talk with you all this afternoon about community engagement and just the importance of this work as it continues to grow in our region and more importantly across the country. And so we'll talk a little bit about our community engagement work, what we're doing, what we're seeing in our region. Hope to also have shared some of your experiences and hear from you all in terms of what you're seeing and how you're engaging communities. And then my colleague Mark, who leads our national center, will join a little later and talk about some of our national efforts in terms of convening and bringing individuals and groups together. So, in terms of how we'll use our time today, just kind of a brief roadmap. And so, do a very brief introduction in terms of who we are, right, as the Camden Coalition. Again, we'll highlight, elevate some programs and different ways that we're engaging community members. And hopefully, some of that will resonate with the experiences that you all are having in your particular communities. We'll feature some of our national work that's happening and also entertain some points that you all might be able to engage with us and maybe even see us in the very near future. And then we'll have some questions and answers. And so for me, it's Friday afternoon at 3 o'clock. I'm not sure what part of the day it is for you all. This is a very formal presentation, obviously with slides, but I am a very informal person. And so at any point you have questions, thoughts, feel free to throw it in the chat. Even honestly, feel free to come off mute if you would like and interject and open to that. But again, really looking forward to a lively and rich discussion for this afternoon. And so the Camden Coalition, who are we? So we're a nonprofit based in Camden, New Jersey, far East Coast, right? And all of our work is really focused on supporting individuals with complex health and social needs, right? And so we provide a lot of different programming and services to support individuals in that way. And so we have, community health workers, nurses, social workers, working in the field every day with people, navigating folks to resources, programming, so on and so forth. We have individuals working with our system partners, organizations, right, in order to do their work better. And more efficient, right, in order to engage folks with lived experience and who suffer from various complex health and social needs. We do a fair amount of data, right? And so, how do we make sure that we're getting the right resources to the right people, right, who have need? And then we do a lot of national convening, training, and teaching, and you'll hear more about that in our conversation today. And so the common thread throughout all of those pieces of work is really, again, focusing on community and focusing on folks with lived experience. And so, as you can see right on this slide here, we truly value folks' experience, their expertise, and what they bring. Right. We believe that, end users of the systems that we represent, they provide invaluable insights for us to be able to come up with solutions that work. Solutions that really help and solutions that don't do further harm to communities who have been impacted poorly, unfortunately, over many, many decades. Secondly, we believe that, people are experts in their own life. And so, while we might have recommendations, right, while we might have a perspective, at the end of the day, people are making decisions based on what they see as best for them. And sometimes that, aligns with our perspective, and at other times, it may not align with our perspective. And that's okay, right? We need to value and elevate that. And so our partnership, right, with community is essential, it's important. And just for the sake of this conversation, when we say, community, we're talking about people. Sometimes you go into some conversations, you say community, you talk about partnerships or organizations, right? But we're talking about people here for the sake of this conversation. And so, how can we build trust with people, right, and communities that are in need of support, and again, doing the best that they can. And so, just to quickly kind of feature a couple different programs, initiatives that we run at the coalition, and a lot of information here, but going to try to give like quick snapshots. And so, if you have more questions and more detail, again, feel free to put it in the chat, and I can definitely answer those questions a little later. But one way that we work closely with our community locally in our region is through our Community Advisory Council. And so this is a group that consists of local community residents, some of which who have come through our programs, right? Others of which are just strong advocates, credible messengers in the community, that really advocate for change, right? And so bringing these folks together to play a role, right, in the structure and governance of our organization. And so both the chair, vice chair of our community advisory committee, they are actually members of our board. Right. And then we have actually four, I'm sorry, additional seats open to community members to, again, play a role in governance, right, within our organization. And our CAC, they provide strong input on, where the direction of the organization is headed, things that they see as being valuable, sometimes things that they see not so valuable, right? And sometimes there's a need for, good dialogue, good conversation, and how do we kind of reconcile, right, the work that we're doing so that ultimately it has an impact, right, on folks who are being impacted the most, right? So our Community Advisory Council really is just a strong program, thanks, Naomi, for our organization and a group of individuals that we rely on tremendously. In addition to our community advisory council meeting regularly. There's also, training opportunities that they take advantage of, development opportunities. They were just in office yesterday for story sharing training that they're all taking a part of. Last month or maybe 2 months ago, there was a diabetes 101. That was something that they wanted to kind of learn more about. And so one of our nurses led us training a session with the group. And so again, just looking for opportunities to keep that group engaged as they, again, are strong pillars in our organizational structure. Another way, different way that we intersect with community members again locally is through our community ambassador program. And so this ambassador program dates back to just prior to COVID. And I know I say that word and it's like, some of us cringe, right? When we hear COVID. However, at the outset of COVID, our community members were trying to figure out how can they be involved, right? Again, credible messengers. Their communities were being deeply impacted, and they wanted to know what could they do. Unfortunately, a lot of the decisions at that time being made in our region were from, the state, right, and organizations, and oftentimes community members were being left out of those conversations. And so, our ambassador program was a way to kind of galvanize, bring together, right, those folks who wanted to be on the front lines, who wanted to be closer to the work, and they served as strong ambassadors, credible messengers, as we navigated the COVID-19 journey. And since then, they've gone on to assist and support a number of different public health issues happening in our local community. Currently, right now, even thinking about ways to assist with Medicaid requirements that will be happening in the very near future, and how can we again reduce harm to communities who are impacted most and who will be impacted most. And so they're helping us to kind of, think through, right, problem solve, and articulate, a clear message that can help individuals in that way. And so, again, just a different way, right, that we engage with community locally and in our region here in New Jersey. So a little bit about our national work, right, and our national portfolio. And so, while we bring together folks locally in our region, we actually bring together folks from across the country as well. And so we have a program that we call National Consumer Scholars, right? And so this is where we bring a cohort of up to 15 folks from across the country who, again, have various experiences with different systems in over an 18-month period. There's training, there's development, there's coaching, right? There's mentoring that happens really to continue to build on their own capacity to be advocates within their own community. Right. And so really continue to think about how are they building, how are they growing their own personal development, whether that's, building partnerships amongst peers, right? Individuals in their own respective spheres of influence, or building partnerships with organizations, right? And navigating what that may or may not look like. And so, as a part of that program, they have, advocacy efforts that they work on, training opportunities. They're invited to our national conference, which you'll hear a little bit about later when Mark joins. And again, it's just a way to kind of keep folks connected, right, in this work, and continues to inform our practice as an organization, and build on the expertise, right, that individuals have given their experience and what they've navigated throughout their journey. And so from our National Consumer Scholars Program, folks have opportunity to join Amplify, which is again sort of just like a speakers bureau, right? And so what we found way back when is people will come to us, Camden Coalition, do you know somebody that could speak to X, Y, or Z, right, in the community? And we will go through our Rolodex. Maybe I'm dating myself saying Rolodex, but we go through our Rolodex. Yeah, we know so and so. Maybe we can connect you right to this person, right? And we did that for a long time. However, we got to thinking like, man, there might be just a more consistent, informal way, right, that we can do that, right? So we now have a group of individuals from across the country that we work with. You can look at their profiles and learn about them more on our website. And these are folks that we connect opportunities with to other organizations, whether that's speaking engagements, advisory groups, research committees, all kinds of different events. And so we spend a lot of time working with the people, right, in order for them to be, prepared for those particular engagements. And we spend a lot of time working with the organizations so that they can create an environment or a structure, right, that best suits the person with lived experience and can be leveraged. And so, again, just another opportunity that we intersect with folks with lived experience and just, again, important to the work and strong messengers in that way. And so, those are just some, again, kind of snapshots of how we engage with folks, lived experience. I'm curious, out of these approaches, which feel meaningful, like, which feel like maybe you might add something or do something different. Are you all engaging in your communities in similar ways? If not, yeah, so curious.
Hey, Roger
Go ahead,
LaCoy.
Roger. Yep, I saw you come off mute. It's all good.
Yeah, no, we just had a CPG meeting, a community planning group meeting yesterday, talking
Nice.
about the same thing. We need to get people engaged, get the community engaged again, and
Hmm.
thinking of ways of, you know, uh, getting people engaged. And it was, I think, the main thing we got out of the survey that we put out was people needed incentives or
Yeah.
incentives are were ranked amongst the highest that they liked or
Hmm.
used to get people in. And it is what it is.
Yeah.
We need to incentivize people. We need to pay people for giving their, sharing their stories. So it's
Yeah.
but the we're just starting a speakers bureau, and
Nice.
they're just starting it up. So I'd like to get your number and stuff after, so you guys
Yeah.
can hook up, and they can tell you about what they're doing with their engagement, and you can tell them about the amplify, because speakers bureaus are always great.
Yeah.
Um,
Yeah. Yeah.
32 years HIV positive. I did speaking for the first, 15 years. It's powerful. It's how you get that message out.
Yeah.
It's how you get people to listen, because they
Yeah.
share and they feel you. It's
Yeah.
it's 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 so much more to feel a person than just to read a person,
Yeah.
you know.
Yeah.
But yeah, definitely great work. Great work.
Yeah,
Thank
no,
you.
no, appreciate that, Roger, and thanks for sharing. And that was one point that I failed to mention. So across all of these programs, compensation, yes, and it's something that we believe in as an organization, compensating folks for their time, and that might look different, right? For individuals based on their needs, right? For some individuals, you have to be mindful of how that might, interfere with different, state benefits and different things, right? So there's a need for flexibility. Even something as simple as, one of our uh, groups express interest in, getting CPR certified, right? And so we knew that, financial compensation would interfere with benefits. But what we said was, we can provide the CPR training, right? Pay for it, get everyone certified, right? And folks felt like that was a way to, show that, hey, your time is being valued. We're heard. So again, compensation, yes, and just need to have the conversation around what does it look like, right? So that we're not doing harm to folks. Yeah, and so thanks again for that, Roger, and can definitely connect on the Amplify work, and would love to talk more about that. And so, just transitioning to one of our more recent, I guess, national efforts. At the coalition. So, working with a few different partners, including PFCC partners. And so, it's PFCC partners, Camden Coalition, Community Catalyst, the Institute for Patient and Family-Centered Care, and a group of persons with lived experience from across the country. And so, some may or may not be joining. I can't see all the participants, but it's a nice group of six folks that join us regularly and join us as a part of our core team as we formulate Inspire. And so Inspire is really a group of, again, partners, organizations, people who have come together to think about what does it look like for health systems and community members to partner in a meaningful way. And so, as you can imagine, that gets very complicated very quickly, right? For systems and organizations to do effectively, right, and meaningfully. But through this work of Inspire, we've been able to outline key recommendations, key core tenets in terms of what does that look like when it comes to best practices. And so you see on the screen, our 9 dimensions of authentic community engagement. And again, this is a framework that we developed through many, many hundreds of conversations with stakeholders, folks with lived experience, folks on the provider side from all across the country. And so you can find this brief on our website in more detail. But just wanted to quickly highlight a couple of the tenets that you see here that was elevated throughout our conversations with persons and organizations. And so the first, the Center to, I'm sorry, yes, the Center to Advance Consumer Partnership, Melinda Carpin Group. I'm sorry. Thank you, Naomi. See, keeping me honest. Appreciate that. How could I forget? And this is recorded too, so she might see it. But anyway, but yeah, so a strong group of partners, organizations who have come together to work on Inspire. And so, again, I don't want to go too deep into these. You can read more about it in a brief. But when we think about meaningful engagement, there are a couple areas, right, that kind of elevate, looking at number 4, particularly, is our efforts, are they impactful, right? Are they measurable? Right. Sometimes, we pull community in and say, we want to do good work, just and only for the sake of doing good work. Right. But how do you quantify what good work is? Right. And so, again, do we have a way to kind of, measure, right? In all parts of healthcare, right? There are measurables, there are KPIs or key performance indicators, that are markers that we look to say this is successful, right? This is what we will implement. This is what we will scale. Right. And so similarly, when we're engaging, community partners, right? What is our mark of success, right? How do we know that it's impactful and that is something to be scaled? Similarly, when we think about, work that's mutually beneficial, right? And so, yes, it might have an organizational benefit, but are the folks, community members benefiting in some way as well, right? And so we want to be clear about what that benefit is, right? So that, the organizations are creating space that also benefits folks with lived experience and ensure that they have access to the information and results of what community participation looks like. And so, a balance of sorts. Another area to be raised is, I guess, maybe number 8 around transformational and restorative work. And so, sometimes we kind of do like these point in time engagements with community members, right? But how do we think about relationships in a more longitudinal way, right? And so I guarantee you, I think it's safe to say most, if not all, the relationships, even in your personal life, that are meaningful, you've either engaged or talked to or intersected with that person more than one time. I think safe to say, yeah, safe to say, right? And so similarly, right, when we think about building relationship with community members, right, it takes more than only one right point in time engagement. And so how do we even think about relationship outside of projects, outside of timelines, outside of an initiative, but really engaging people for the sake of understanding people and wanting to understand who they are. And then lastly, I'll just say 7, right? Resources and being compensated, right? We heard a little bit about that. And so people are committing time, effort, resources. And so making sure that we're compensating for that in a formal way, right? And really that further elevates organizations' commitment, right? To recognize and to value perspective that folks with lived experience bring. And so those are just a few kind of, places to highlight. There's a lot more detail to each of these. Folks wanted to access the brief, you can again on our website. But curious, how do you know when a project or an engagement is mutually beneficial? Have you seen that come up in your space, in your work? How do you know that? How do you sense that? Yep, go for it, Vicky.
Hi there.
Hey,
Hi, I'm in Vermont, end of my day, so I'm a little
nice.
disheveled.
It's
It's late
okay.
here.
It's all right.
All right, all
If
right.
it's only the end of the day, Vicky, it's all right. I'm like that. Oh,
You're in the
you know,
middle. Yeah. Oh my
yeah,
gosh. All right. I just wanted to say I love your question. I would say it's when our advisors or community partners generate. So it's not
mm,
generated from the organization, but it's generated by that group. That usually is more of a co-design transformational process. And I think it ends up feeling so much more trust than when it comes from the organization and then they bring the partners on, which I'm not saying that doesn't happen. That usually is what happens. But we're really trying to shift the narrative here at the University of Vermont Medical Center and the Children's Hospital to have our advisors to really work with our community partners to generate the other way to
yeah,
co-design.
yeah, yeah. And that can be hard to do to find that balance, right? We've been in conversations even recently, right? Where the organization's, goal or, work doesn't necessarily align with where community members might see as a priority, right? And so how do you really come to, right, with those conversations, right? And, be willing to kind of sit in that place of maybe even discomfort, right, in order to make progress. And so, yeah, so that can be a challenge for sure. Uh, Curious about others. How do you know, when an engagement is mutually beneficial?
Hello. I can't figure out how to raise my hand. I
It's all right,
apologize.
Lillian. You just did. You just did. It's okay.
Um, I loved what the other lady said about engaging the parents or the families. I am the facilitator for the Parent Advisory Council at Children's Memorial Hermann in Houston, Texas.
Houston.
And
Okay.
that is one of the things that we are working on doing. We've been going for about 3 years now. So we started in the middle of COVID and
Mhm.
have sustained and grown. But we have this year asked the parents, what do you want to do? What do you want to see? And so they are giving interviews so that they can have the new residents learn about what it feels like from their perspective. They're being consulted on build outs. And our quality and safety team is actually going to uh, be in our meeting next Tuesday night, actually, and they are going to become a regular part of the team so that we can engage the parents in the beginning rather than just having them be on a committee for a report out. We want to have them be
Mhm.
part of the process. And so I'm excited to see how this goes this year and to see what it's like with the parents driving the bus rather than me driving the bus. I'm really, really excited.
Yeah, yeah, yeah. And that creates a point of vulnerability too. I mean, as the parent, we don't have the keys, right? So, yeah. So, even giving up that power, right? In those conversations and being willing to, listen, right? And even acquiesce to the priorities of others, right? And so, kudos to you and your team, Lillian. Cool. So yeah, so just something to think about, right? In our work, is it mutually beneficial or is it only a one-way benefit, right? That we have as an organization, and is there, a need to kind of talk things through with folks who are kind of in our, local communities to kind of think about how we can align priorities, so that yes, Lindsay, so that there's a win-win, right? And vice versa. Cool. All right.
Yeah, I was
So, yep. Who is that?
just
Roger? Yep, go for it, Roger.
yeah. So I mean, the group, our community planning group, is for it mainly about HIV, Hep C, and we require we don't require, we strongly encourage our subcontractors to be at the CPG meetings.
Hmm.
And then the patients that are involved, or the people who are not working, get stipend to be there,
Hmm.
because the other people get paid from their companies to be at the meeting. So it's
Yeah.
only right that us patients get paid also. But we find that, it's strongly encouraged, but people like coming to it because, they get we meet every 3 months. We give a lowdown of what the state looks like, what the landscape looks like. And it's, we find that people like to come back. So we
Hmm.
feed them, it's an all day thing. You get breakfast, you get lunch. And if you're coming from far away, we give you, put you up for the night also.
Okay. And
Yeah,
where are
but
you based at, Roger? I might have missed it earlier when you commented. Where you?
what's that?
No, I said where are you based at? I might have missed it
We're in
earlier.
Des Moines, Iowa.
Iowa. Okay. All right. So Midwest. Okay. Great. No, that's awesome to hear. And so, like you said, really thinking about like access, right? Who has access to the table, and how do you create an environment in a space that, people can opt into, right? And feel good about opting into. And so it's great that you guys are really thinking those things through, right? As you're working with folks. And so awesome. And so I think my colleague Mark has joined us. Yep. And so that was a snapshot, right, of our kind of community engagement work, some of our local work, right, some of our national work. And so, as I mentioned earlier, we bring a lot of folks from across the country together, right, in convening spaces to think about, how do we elevate the practice, right, of complex care in their regions and their respective communities, and how do we just get better, right, at the work that we do. And so I'm gonna pass it to Mark to talk about some national features of our programming, and also ways that we intersect with folks with lived experience even in that space.
Great. Thanks, Victor. And sorry, I'm joining a little bit late. I had a conflicting meeting, but happy to be with you all. Mark Kamowicki, General Counsel and Senior Director at the Camden Coalition. Haven't been there quite as long as Victor, but it'll be 12 years in September. So, um, longtime coalition person. Remember when we didn't have a national center, and my work was all focused on policy in New Jersey. So the National Center was started in 2016 with funding from Robert Wood Johnson Foundation, AARP, and Atlantic Philanthropies. The goal at the time was to really coalesce an emerging field of complex care. This feels like forever ago, but it was like early implementation of the Affordable Care Act. It was the first Trump administration, so it was like a little bit different. Um, there were a lot of folks that were suddenly turning to think about value-based care, population health, working with people who had extremely complex medical, social, and behavioral health conditions and were using a disproportionate amount of services and not getting great results. And like there were opportunities to give better care in the community than having people go in and out of the hospital without ever really getting their needs met. And so tried to create essentially a field of practice around working with those folks. We've all often described it as the place where healthcare meets social services. And I guess, not just social services. There's a lot of other um, sectors at that intersection, housing, sometimes criminal justice. And then we've always placed a strong emphasis on the voice of people with experience with these systems. We think of it as a systems problem of broken and siloed systems that don't really serve people well. And so people that have been through those, navigated those systems are closest to the problems and often closest to the solutions. We endeavor to like create shared learning through relationships. We've put on a conference every year since the very beginning. And I'll talk a little bit about that conference. We also do a lot of training and education, technical assistance, and consulting, where we're working with organizations to help them do their jobs and work better. Sometimes that's introducing them to helping them navigate a new sort of line of business. Other times it's trying to help them do things like community engagement better. We also write up not only our own work, but the work of partners and really try to share with people what we're learning in this field that continues to be growing and evolving and by no means is fully established at this point. Next slide. So I'm here to talk about our conference primarily, and it's an annual conference that we move around every year. Last year it was in Pittsburgh. The year before that it was in Boston. This year it's in Portland, Oregon. Part of the moving it around is to be able to showcase what complex care looks like in each of these different regions of the country. Another part is that we partner with a co-host that invests financially in the conference to be able to make it affordable to participants. And so this year's co-host is Care Oregon. They are a nonprofit health plan in Oregon that serves Portland, but also other regions of the state. I guess skis. Excuse me. And then, Naomi, we're going to give this a shot of showing you a little video about the conference. And if it doesn't work, we'll just quickly move on. I know we don't have a ton of time, so I won't try to problem solve it. But hopefully you get to hear our colleague Gladys.
This conference is a conference where compassion is at the center of care. It is for doctors, nurses, healthcare workers. It's for patients and their families. It is for everyone.
If you want...
Sorry, I'm the tech person who messed it up.
Naomi, you're doing great.
I wanted to make sure you could hear it. Come back.
Yeah, we can hear it.
Oh, we heard it, Naomi.
Okay. I'm trying to get it to play again.
You just press the play button in the corner there, Naomi.
I don't, wait, where'd it go? It's hidden from me. Okay.
Oh, you're right there. Click.
If you want to have a little bit of optimism about the possibilities, this is a place to be. People are they're working on stuff. They're working on important stuff.
We're seeing that wherever we go in America, the work we do is relevant and urgent. My passion is about making those system changes that just make it easier for people to get their needs met. All of us are committed to that because we're all here talking about how systems fail people.
The healthcare system is broken. On the other hand, I come to this conference and I'm really impressed at the youth, the diversity, and the passion of attendees here.
I didn't expect to learn as much as I did, especially with all different areas from different people, diversities, and different communities.
There are a variety of ways of doing things, and I think really placing behavioral health more centrally in some of our conversations is definitely a big takeaway.
This conference is giving me the space and kind of the permission to actually write down what I think the healthcare system should look like.
The best thing about this conference for me is always the people. You get hands-on experience talking to frontline workers. You impact change in healthcare.
The thing that I'm most proud of is the fact that we are finally recognizing people with lived experiences as an integral part of our healthcare system.
I believe when we're dealing with complex care and social needs, those most impacted are closer to the solution. Their voice needs to be heard and woven throughout any implementation that has to do with their care.
There's a lot of people unnecessarily experiencing harm and oppression in this country. And we have the money to make sure that all of us are okay. Not just a portion of us. All of us are okay.
This conference is for anyone who's just trying to help people get their needs met by social service systems, by government systems, by nonprofit systems, and who want to understand that they're not alone in that journey And this is a place where you can learn best practices and find good friends to carry you through the hard times.
Great. Naomi, snaps to you. That was great. I think that's the cleanest I've ever had this video go off. So let's go to the next slide. Lindsay, while you're clapping, I know you've been to our conference before. I'm wondering if there's anything you'd add to, and I didn't give you any notice to this, so
Yeah.
I'll keep talking for a few seconds while you think about what you might want to say. But good, bad, indifferent, like your experience of the conference.
Yeah, no, Mark, I think the thing that I love most about putting care at the center is just the opportunity to be with like-minded people and have like really impactful conversations. And I think someone on the video said it best. It's just you have the opportunity to meet so many different people that you potentially normally wouldn't meet in like your day-to-day kind of work. And I think that goes for both people with lived experience and our healthcare partners too. And I think that's another thing is for our healthcare partners, this is like the perfect opportunity to do community engagement, to do patient family engagement, because there are so many people with lived experience there who are eager and ready to, you know, have constructive conversations. So I think just being with our people, it's one of the most fun things.
Thanks. So, here's a little bit, some bullets with some summaries of aspects. So, you know, it really is cross-sector by design. We think of complex care as being cross-sector. And so, of course, we want to make sure that we get people there from different sectors. And that includes people with lived experience that may be affiliated with healthcare organizations, may be affiliated with housing organizations, may be advocates, or just maybe, you know, involved in PFABs or what have you. We price accordingly, so we try to make it as affordable to people based on sort of the kinds of organizations that they're with and their roles in those organizations, recognizing a lot of people don't have sort of education and travel budgets that they can just pull on. And so we actually lowered the price this year, recognizing that we were starting to price people out. And so we brought it down. I see Karen's comments in here about virtual attendance, that we recognize a lot of people can't attend. During COVID, we did do 2 virtual conferences. I think they were pretty successful because they were exclusively focused on the virtual experience, and we were able to do a lot. But we were very happy to get back in person because, as you heard from the video, there's so much of it is about relationships and what you can get from being in the same room with other people. That said, we do record all the sessions, we record the workshops, and so we have the ability to share those recordings with folks after the fact. When we tried in Boston to run a hybrid with virtual attendees and live attendees, the juice wasn't worth the squeeze. It was not a lot of people showed up virtually. It was a lot of logistical hiccups and challenges. They couldn't participate in the interactive stuff. And so, you know, and often we would have rooms that were relatively empty of virtual people. We had like live virtual sessions and they weren't as well attended as we thought. So we actually concluded that recording and making it available afterwards gives people that can't afford to come access to all the content. They just don't get the live virtual experience, but we weren't pulling that off all that well. So maybe in the future we'll try it again, but right now we really are focused on the in-person experience and we keep innovating. So like most conferences, we have main stage plenary sessions, we have breakout workshops. We also have something called the Beehive, which some have described as an adult science, like a science fair for adults. It's posters, it's tables and booths. Really, instead of trying to sell stuff, it's people talking about their work and engaging one another. We started last year something called a 2-minute buzz, which is like a really, really brief TED Talk and was built off of something we saw at University of Pennsylvania, which was like a 60-second talk. So we doubled the time, and they were phenomenally engaging. So we have those, brings a lot more voices into the mix. Last year we did it for the first time. We did site visits to both cultural and programmatic locations. So museums. Last year we went to the Pittsburgh Steelers Stadium, had a tour there, but also went to a housing program and a clinic and a community development site. And it was really great opportunities for people to network and really get to know each other while they were out on these sort of 3-hour field trips. CEUs, CLEs for people that care about that stuff, and a long-standing commitment to having people with lived experience in our programming. We make sure when we're inviting folks to main stage events that we've got a good representation of people with lived experience, and then we give points and really look for workshop proposals that include people with lived experience as part of the faculty there. And so something like 80% of our sessions have at least one person with lived experience. We also do have many people with lived experience on our conference planning committee. I think Victor talked about our National Consumer Scholars. A number of the folks who were consumer scholars, sort of when they finished their scholarship, they joined our planning committee. So I would say about a third of our planning committee are people with lived experience. And we just met this afternoon, and they were some of the most vocal folks on the call. Next slide. I want to make sure I leave room for comments. And questions. We did the testimonial, so I jumped the gun there. This year, one of our new strategies was to partner with 3 different organizations. So hopefully you've seen this before. But Stephen has been part of our planning committee now for a while. We've done a lot of collaborative work at our conference, and this year we said let's have you guys be a content partner. And so having PFCC think about like its old meetings, it brought its network together. Now coming to do that at our conference, really creating space for PFCC partners and your network to be able to come together in fellowship and have content that really is the kind of content you had at your own meeting, but also be part of a larger umbrella. We're doing this with the National Center for Medical Legal Partnerships and also the Society for Social Work, Leadership, and Healthcare. So we have 3 content partnerships. They've produced well over 100 new attendees as a result of those partnerships, and we're really excited to continue to build. So this is the first year, let's go to the next slide, that we are having workshop. Oh, sorry, before I get into workshops, PFCC Partners is putting on a free pre-conference on Tuesday on Advisory Councils Transformed, sort of a new framework, really hands-on opportunities to work together and to be able to come home with some concrete strategies and roadmap for how you engage people with lived experience in your healthcare improvement work. So that's an opportunity on Tuesday afternoon that is unique and we're really excited about. Next slide. The audience, as I've mentioned, very cross-sector by design. Lots of different folks from leadership to frontline, from social service, healthcare, government, researchers, policy, philanthropy, caregivers, people with lived experience, people that have multiple of those hats. Valuing lived experiences is huge. You can see in the bottom some numbers here. We ask everyone when they're signing up if you have lived experience of complex health and social needs or as a family caregiver. You can see how high these numbers are. It's phenomenal. So next slide. So this is the first year we're doing workshops, tracks. We've always had workshops. We've gotten to a size where it's almost overwhelming, like choose from 7 different workshops at any given time. And so we've created these tracks. They're not binding mandatory tracks. You can go from one track to another. That's fine. But it's a way of organizing the content, and it helped us in our selection to make sure that we have sort of a balanced set of offerings. You'll see at the bottom, partnering with people with lived experience is one of the 7 tracks. And so, and on the right are the 2, 4, 6, 7 different workshops that are happening in this track. So I know some of you on this call may be presenting those. So thank you for stepping up and proposing workshops. We had almost 150 workshop proposals this year, could only select a little over 40. So it was very, very competitive. But we were thrilled to have so many great workshops in this category. Next slide. Great. That's like a quick overview of the conference. I could go on and on, but I'd rather be able to respond to specific questions or thoughts or concerns that you may have. And Naomi, maybe if there's anything in the chat, I'm having trouble reading all of it. If you want to vocalize, that would be great. And maybe we take this, slides down so we can see each other.
Yeah, thank
Thank you.
and Victor so much for this. I've not seen any actual questions come in the chat that haven't been answered already.
Okay.
But we did have questions that came in with registration. So let me ask some of those. As you all have alluded to some of them. One was about how do you continue, how do you see this work moving forward with cuts to Medicaid and how things are going with the current administration? So how will that impact the work and continuing to build with and partner with people with lived experience?
Victor, I'm looking to see if you're coming off mute, but I'm
I'm
happy
sorry.
to
Yeah,
answer
I'm
too.
sorry, Naomi.
Yeah.
I was typing, trying to respond to someone in the chat there. So you were saying, how do we
See Medicaid cuts. Here, you finish your chat. I'll give my 2 cents and then you jump in and add.
Okay.
So I think everybody's worried about that for sure. And having people lose coverage and having states have to like really tighten their belt. Managed care plans having less money in capitation means that they have to think about cutting back services and other expenses. And, we know that new things are often the first to go. Innovative things are often the first to go. I think we are hopeful that we have proven the value case of this and that there are a lot of people really invested in whether it's the complex care work or partnering with people with lived experience or the combination. And so they're not going to just let it go easily, and that there is a value case to be made for it. And we have champions like inside of government and inside of health plans, but we're not fooling ourselves. These are hard times. We have to be scrappy and creative and be able to show that value case and speak out. And there are threats on all fronts from the federal government. The most recent executive order talking about getting rid of housing first, getting rid of harm reduction, civil commitment for people with mental illness. I mean, it's really mean-spirited and against all the evidence. So I'm not naive, but I also don't think this work is just going to disappear. So I think it's up to all of us to sort of double down. But go ahead, Victor.
Yep, and I would just add, and I think, on the ground in our region, also thinking about our organizational, functions, assets that can help to reduce harm, right, to individuals that we know will be impacted, right? And so, for instance, we run a regional health information exchange, and so how do we use that to perhaps, flag or support individuals that we know have increased, health risk, right? That might, be impacted poorly as a result of these changes. We have again outreach workers, community health workers. How are we activating those staff in order to do outreach, awareness, and things of that nature to support individuals? And so I think it's kind of the broader system level engagement in addition to kind of the tactical on the ground frontline engagement.
Thank
Hey,
you for
Victor.
that. Go ahead, Roger.
Yeah, I just want to share, Iowa is starting to work requirements January 1st in the state for recipients. We started to figure out how we're going to document the volunteer hours people are putting in. Because all of this time that we're doing here is volunteer hours and can go towards your requirements.
That's awesome, Roger. So I don't know if you saw I
did see it,
directly
yeah.
chatted you. Okay, all right. Let's follow up because we're doing a lot of work in New Jersey around those workforce requirements, and we'd love to share notes, and then obviously want to amplify stuff that you mentioned earlier as well. Yep.
I don't see any other comments or questions in the chat. I have one other one for you. And I have it. I didn't write it down, and I should have because it just left me. Oh. How do you talked about all the programs and how you all work with people with lived experience. Can you speak to how you engage them? So where are you meeting these people to actually then begin to do the work?
Yeah, I think, in our local work is like going where the people are, right? Kind of being out and about, and being present, right? I think, similarly to the most relationships, if not all relationships, right? There are key pillars, right? Being able to be in communication, to stay in communication, to build relationship, to build trust, right? And being in the presence of, where people are, and being able to opt into their environments, right? And not always trying to pull them to places of comfort that we might have, right? To our environment. So I think, locally we give a lot of thought to that. Nationally, I think, we have a lot of, partnerships, right? Relationships with organizations, as you saw. We have a lot of, partnerships, relationships with people, right? And so also leveraging their relationships, right? And so they oftentimes play a connecting role for us, right? Introducing us to people, other organizations who are like-minded, and to want to grow their work. And so, I think there's a term, real, recognize real, right? And so when you are real, when you are genuine, when you are authentic, people are willing to make connections and trust you in that way. And that's something that we don't take for granted in our work.
Yeah, and I think, on the National Center side, when we're doing work like we built a complex care certificate, and we wanted the voice of people with lived experience. We're benefiting from the national network that Victor and Eveline and the community engagement team at the coalition have built. And so folks that are in our Consumer Scholars program, they have a project as part of that program. And so one of those projects may be reviewing and giving input on curriculum content or developing a presentation for our conference or putting on a webinar. And so we are really lucky to be able to take advantage of those networks and have projects that people can participate in.
Wonderful.
And then it does just go like word of mouth. It's crazy. And people are so happy to come to our conference and see each other, and folks that have met on webinars or in other spaces and get to meet each other in person. They're so excited about it. So yeah, here's the final slide. We'd love to have you. We recognize cost is a challenge. We do have scholarships each year, but there's never enough money in the scholarship fund to be able to support everyone. So we will, if you can't make it to Portland, we will be in Oakland next October, knock on wood. I'm just waiting for the final approvals from Kaiser, and would love to have you there. So, and it all starts with like workshop proposals and beehive proposals. you all have lots of experience and wisdom to share, and so we'd love for you to, to offer those. We'll probably open that call for proposals in January, February of next year. So, but we hope our partnership with PFCC Partners will continue, and so there will be PFCC Partners at the center again next year. And it really is something where we're like building momentum. So thank you all. I'm going to stop because I know you guys got to close.
So much, Mark and Victor. I'm so excited about this partnership, about being in Portland this year. This has been recorded, and again, it will be up on our YouTube channel. And just want to say, so we will also have a special community of practice in a couple weeks where we'll have more information about the National Consumer Scholars. So excited and really being able to show off the partnership and the work that is being done. You all have a wonderful and a safe Friday, a great weekend, and we'll see you next month. Bye, all.
Thank you, Victor. Thank you,
Thanks,
Mark.
everyone.
Thanks,
For
everyone.
sure. Yep, enjoyed it.
Thanks all.
Thank you.